Good day to everyone. I hope you're all doing well. Today I'm going to share some essential information that all providers in Scotland need to know about. On the 1st of April 2024, a new piece of legislation called the Health and Care Staffing Scotland Act 2019 will come into force. But let's rewind a bit. Back in the day, staffing in the health and social care was pretty straightforward, but it wasn't always ideal. You see, numbers didn't always match needs, leading to some gaps in care. Now, fast forward to 2024. The new legislation was crafted with input from various professionals, experts and providers. Guidance such as the Health and Social Care Standards and the various inspection frameworks developed by the Care Inspectorate were used to develop the Act. To ensure safe and high quality care, providers must adhere to the guiding principles, such as improving standards and outcomes for service users, taking account of the needs, abilities, characteristics and circumstances of different service users, respecting the dignity and rights of service users, and taking account the views of staff and service users, ensuring the well-being of staff, being open with staff and service users about decisions on staffing, allocating staff efficiently and effectively, promoting multidisciplinary services as appropriate. These are similar principles that were in Regulation 16 of the Public Service Reform Act, which will be revoked on the 1st of the 4th 24 when the Health and Care Staffing Scotland Act 2019 becomes law. The main difference between both legislations is on staff well-being and recognising the benefits it brings. The benefits of focusing on staff well-being: increased productivity, improved performance, sustained workforce, better attendance, improved satisfaction and increased morale. Healthy, engaged and well-supported staff lead to better outcomes for everyone involved. Now, let's talk about determining staffing levels. Providers must consider factors like the nature of the care service, the needs of the service users, and the skills of staff. Staffing levels will be determined by an assessment of the needs of the service users, the skills, competencies and number of all staff within the service, the environment. There is no national staffing tool advised at this time. However, the Care Inspectorate have consulted with stakeholders and are now undertaking a review of staffing tools for use in social care setting. It is important that you have evidence of seeking the views of service users, staff, relatives and visiting professionals. Here at QCS, we have included a question in the relevant satisfaction surveys. Of course, asking the question is only the start of the evidence. Most importantly is recording how it was considered and any change that was implemented as a result of others' opinions. Multidisciplinary involvement is another key factor. Collaboration with colleagues helps identify strengths and weaknesses, leading to continuous improvement. Environmental factors also play a role, influencing staffing numbers based on premises layout, which could have challenges with observations. Lastly, staff training is crucial. The legislation clearly states that it is the responsibility of the provider to ensure that people working in the service receive appropriate training for the work they are about to perform. This includes time off from work for the purpose of obtaining further qualifications appropriate for their work. There are resources available to support staff in understanding and implementing the new Act. And remember, professional judgment and transparency are vital throughout the process. Thank you all for joining us today. Here's to safer staffing and better outcomes for all.